So I have the honor of introducing Dr. Mitzi Williams. So Mitzi Joy Williams is a board certified neurologist and fellowship trained multiple sclerosis specialist who serves as the founder and CEO of the Joy Life Wellness Group Multiple Sclerosis Center in Noonan, Georgia. She is considered a subject matter expert in neurology, multiple sclerosis, and health disparities. Dr. Williams has over 15 years of experience in the field of multiple sclerosis. She received her undergraduate degree in neuroscience and behavioral biology from Emory University in Atlanta, Georgia, and received her Doctor of Medicine degree from Morehouse School of Medicine, also in Atlanta, Georgia. She completed her internal medicine internship, neurology residency, and multiple sclerosis fellowship at Georgia Health Sciences University, formerly MCG, in Augusta, Georgia, where she received numerous accolades and served as chief resident of the neurology residency program. Dr. Williams has spearheaded and participated in multiple steering committees and work groups to further research in underserved populations with MS, with a focus on the African American population. She has recently joined efforts to increase diversity in clinical trials and educate the community about the importance of research participation. Through collaborations with national and international committees, she advocates for people living with MS to share in the decision-making process with their healthcare teams to combat this disease. Dr. Williams is the author of MS Made Simple, the essential guide to understanding your multiple sclerosis diagnosis. She continues to live out her mission to provide personalized multiple sclerosis care delivered with expertise, compassion, and joy. So it's my honor to welcome Dr. Mitzi Williams.
Hello and good afternoon, everybody. I am so very excited to be here, and thank you, Mindy, for inviting me. And I'm just going to share my screen with a pop-up of two of my favorite people that I got to hang out with last week at the consortium. Any familiar faces there? All right.
It was so much fun to see you guys. I can't help it. I'm too excited. All right.
I know it. All right. So let's get into it. So I am going to talk about pain and mostly about kind of alternative management of pain. Fortunately, Dr. Gretchen has done quite a bit of my work for me because a lot of it is about exercise and movement. And I was getting my exercises in while you guys were. So let's get right into it. All right, so when we think about pain, it's very interesting how the evolution of understanding pain has come a long way in the field of multiple sclerosis. I remember when I first started my training, which was just a few moons ago, not many moons ago, but we used to think pain was not a symptom of MS. And if people came and reported pain, you know, the thinking was it's not MS because MS doesn't have pain. Well, now we know for sure that there are a lot of different types of pain that can be involved in people who have multiple sclerosis. And this is just kind of a graphic looking at some of the different symptoms of MS. And we can see here that pain, about 63.2% of folks reported that pain was an issue. But here separately, we see headache, which also qualifies as pain, as well as numbness and tingling, which can sometimes be painful. So there are some studies that suggest that up to 75% of folks with MS may report some type of pain symptoms during the course of disease. So when we think about approaches to treating MS, I kind of like to think of it as a 4-layer cake because I like cake, right? So the first layer of the cake is we have therapies for exacerbations. That's when someone has a new symptom that comes on, lasts for a period of time, 24 hours usually, or more, usually several days to several weeks, and then kind of gets better or levels out. And there are treatments that we use for that, primarily steroids. Then we have disease-modifying therapy, which is the second layer of the cake. And that is more disease to help the underlying immune system problem, because we know that although we can treat some of the symptoms of MS, the overall issue is that the immune system is overactive. So there are medications that we have for that. And we now have over 20 different therapies for MS. So that treatment regimen or armamentarium has expanded greatly, even in the past decade. But the layer we're going to focus on today is the last two layers, actually, symptomatic management and rehabilitation, which really could kind of fall into one layer, but why have a 3-layer cake when you can have a 4-layer cake, right? So symptomatic management is more so the different symptoms of MS. Sometimes if there are certain types of pain, we can treat that. Sometimes if there are bladder issues, we can treat that. There are other symptoms that we're not so good at treating or don't have any treatments for. And then rehabilitation really involves specifically our amazing folks like Dr. Gretchen, our physical therapists, our occupational therapists, our speech therapists, etc. All right, so let's move on for the cake. So comprehensive care. This is a really cool definition of comprehensive care by the MS Society. And I really like all of it, but I'll just say the last sentence. In either case, the goal is comprehensive, coordinated care to manage the disease and promote comfort, function, independence, health, and wellness. So when we think about MS and treatment of MS, I like to think of things holistically, right? Because there certainly is a part that medications can play in improving quality of life, but there's a part medicine plays and there's a part you play, right? And no medicine will ever get rid of the part that you play in improving your own health. And so I like to focus on both aspects to see if we can reach a balance in improving outcomes for people living with MS. All right, so I like this graphic because pain is more than just a symptom in a certain place of the body, right? There are many different things that go into different pain. There are different types of symptoms that people have with pain. It can involve different parts of the body. There can be different ways that we can remedy it. There is pain that is related to MS, but there's also pain related to other things. So people with MS get other things like osteoarthritis, right? People with MS get other issues like bulging discs in their neck, et cetera. So part of the issue when a patient comes to me and says they have a pain issue is trying to figure out, do we think it's related directly to the MS? Do we think it's related maybe to a symptom of MS, but not directly from the lesions? Or do we think it's related to something totally different? And so that is part of the issue of trying to figure out where the pain is coming from and how we treat it appropriately. All right, so I like this graphic because number one, the picture in the middle suggests that the symptoms of MS, especially with pain, can be very variable. So one day you may be feeling like you're on top of the world, and like this guy, you're digging a shovel. I don't know what he's digging in the garden, doing everything. And then the next day at the same time, you may be completely wiped out, totally out of it, not being able to function. And so often what happens is that sometimes we can get in this cycle where you've got pain, and then you may say, oh, I'm not going to do as much because I've got pain. And then you don't have as much functioning of your muscles. You lose some of your strength. And then you create a list of things that you absolutely cannot do. And it begins to interfere with other things from your sleep, your work, your mindset, et cetera. And the cycle just continues and continues. And so part of the way when we look at kind of looking at pain and treating it holistically is to try to break this cycle, right? To try to decrease the pain, but also to try to improve some of these other functions, which can also decrease pain. All right, so let's talk about a couple different types of pain that we see commonly with MS, right? And I'll go into a little bit of detail about these, but kind of describing some of the symptoms. So there's neuropathic pain, which can come from lesions directly, usually in the spinal cord, that affect many different parts of the body. So the words that I have listed here are ways that people describe the pain. So for some people, it's numbness or absence of sensation. And that's the person who says, I actually had a patient yesterday that says she has to put one leg in the tub first because that leg has a better temperature sensation than the other leg. So if she puts one leg in, the numb leg, then she may actually burn herself because she doesn't feel how hot it is. So there's numbness or a lack of sensation. There's also tingling, which is often people describe as that feeling like something fell asleep, like your leg fell asleep and it's waking up. So that tingling sensation, and sometimes it can be aggravating, but sometimes it can also be very painful depending on the intensity of the symptoms. Other people have a burning sensation, like they feel like their limbs are on fire, like they feel like their leg is on fire, or their arm is on fire, or their hand. And so that also can be very uncomfortable. Also, I have some patients who report an electric sensation. We often see this associated with a symptom called Lermite sign, which is essentially when you have damage to your spinal cord and you flex your neck, you get like an electric sensation down the back and through the body. And that actually can occur in people who have MS, but also in people who have other conditions. So for instance, I had a disc that was popping out in my neck and pressing on my spine, and I actually had Lermite sign, and it felt like I stuck my finger in a socket. So very uncomfortable, especially if you can't move your head certain ways, which you need to move around and do, move your head to function. And then other kind of less common, but also irritating symptoms are sometimes people have an itching sensation. And then other times people have a crawling sensation. So those are less common, but can be signs of nerve dysfunction. You know, one of the things that we have to distinguish when we're talking about MS pain is that often these symptoms can be very similar to what we see with peripheral neuropathy when people have conditions like diabetes. So we have to make sure that to determine if the symptoms are coming from the MS or coming from some other conditions. All right, so muscle spasticity and pain. So this is one of the most common pain symptoms that I treat related to MS. And so essentially it's a stiffness of the muscles. So when those nerves are damaged and when that myelin is damaged, there's basically a disconnect where the muscles are overactivated. So your muscles that are supposed to be relaxed are contracting, and that's what causes the stiffness. And there are varying degrees of stiffness, and it comes in a couple of different flavors, as I like to say. So for some people, it can be a sustained contraction, right? Some people can have actually what we call spasms, where let's say the leg will just kind of stick straight out and it just won't move for a few seconds. Other times people can have jerking movements where they may kick somebody, kick their spouse in the bed. Now some of you may be kicking your spouse because you want to, but there's some people who can't help kicking their spouses. So sometimes it's a sudden movement like a kick that may occur. Other times it's just a tightness. Some people say it feels like a rubber band, or it feels like I did a vigorous workout, but I know I didn't do any workout. So there's like a soreness. Also, sometimes there can be a pulling sensation around the joints because the muscles are pulling. So sometimes it may manifest as kind of referred pain to the knees or to other joints, but it's a pulling sensation from the muscles being overcontracted. The symptoms are more common in the lower extremities. And one of the other difficult things about spasticity is that it can be triggered by a lot of different things. So spasticity can be very sensitive. If it's too hot, you can get spastic. If it's too cold, if your clothes are too tight, if you have an infection, if you have sudden movements, if you move too much, if you don't move enough. So that's one of those symptoms that can be very sensitive, where people can have many different triggers or some severe triggers. What about headache? Now, many people ask if headache is a symptom of MS. So I generally wouldn't consider headache a symptom of MS, but many people with MS have headache. And there is data that suggests that the risk or association of migraine or the occurrence of migraine is much higher in people with MS, or is higher in people with MS than the general population. Also, people can have tension headaches, or what we call new daily persistent headaches, where they may just develop a daily headache that won't go away over several months, and that can be for a variety of reasons. Also, we have trigeminal neuralgia, which technically can be spoken of as kind of a headache, but a little bit different. So this is a inflammation or damage to the trigeminal nerve, which you can see here is a nerve that leads to sensation of the face and also some of the muscles. And essentially, people can develop severe pain in these areas of the face. It's often episodic. It can be worsened by certain things like chewing or even talking. And then the way we treat it is we use certain medications, and sometimes there are procedures or even surgeries that can help improve trigeminal neuralgia. But we'll get a little bit more into treatment later on in the talk. Now, let's focus a little bit more on setting priorities for pain management with MS. Okay, so things that we have to consider. How much is the pain interfering with your daily activities? I have some folks that say, Dr. Williams, I've got a little bit of numbness. It's not stopping me from what I'm doing. Let's just keep monitoring. I don't want a medication for it. Okay, so all pain, depending on the severity or lack of severity, does not necessarily need to be treated with a medication. Also, when we do have pain that needs to be treated with certain medications, we have to think about the side effects. We talked about that circle of pain and decreasing activity, but there's also a cycle that can happen if you have a pain, we give you a medication. Let's say use a symptom like fatigue. You have pain, you have fatigue from your MS. We give you medication, the medication makes you more fatigued, right? And so that becomes a cycle where we're trying to balance actually, the management of the symptom, but also manage the rest of the symptoms of MS. And that's why I have this picture with this tightrope, because sometimes it is walking a tightrope. If we go too far over one side, we can make other MS symptoms worse. If we go too far on the other side, you could be in severe pain that limits your function. Also, we have to think about safety, right? Does the medication that we give interact with any other medications that you're taking? And then, of course, there's cost. Sometimes different procedures can be very costly. Sometimes adding on medication after medication can be very costly as well. So we have to think about all of these things and keep them in mind when we're thinking about managing pain in MS. So medications. So again, medications can play a part in decreasing pain symptoms. And so most of the medications that we use for nerve pain fit into one of two classes or three classes. We have our anti-inflammatory medications, which sometimes you think of as, your ibuprofen, your Tylenols, those type of things. But specifically for nerve pain, we usually use medicines that are anti-seizure drugs or antidepressants. And so the reason I always tell my patients that up front is because if they go and look up the medicine, I don't want them to think Dr. Williams is trying to sneak me something for depression. Dr. Williams thinks I'm depressed. No, those are the medications that we use to treat nerve pain. They happen to work for those other conditions, but also work very well to decrease nerve pain. When we think about spasticity, there are muscle relaxants that we use. Many of them are used for other conditions. Baclofen is a very common one. We also often use benzodiazepines, which is, if you think about Valium, those types of medicines, sometimes those can help spasticity in some cases. Then there are cannabinoid products. So, the use of CBD and THC has certainly become more publicized recently as there are more CBD products available, and there's now research being done looking into THC and CBD. And there is some evidence that CBD, the anti-inflammatory component of marijuana or, the plant, can actually have some anti-inflammatory effects and help symptoms like spasticity, as well as some chronic nerve pain. But certainly there's much more research that needs to be done for us to better understand how to use some of these compounds. And then in some severe cases, opioids are used. So definitely not as much as they were used in the past because of issues, of course, with regulation and addiction, et cetera. But sometimes, that is what some patients need to control their pain. And so that's when we coordinate with a pain management specialist, usually to help us with those types of medications. So what about procedures, right? So medications play a part. Sometimes there are also procedures that can help. I often recommend procedures for many of my patients because it helps keep us off of medication sometimes. And if you can do a procedure that may last you, give you benefit for several months and not have to take medication, that trade-off may be a lot better for some than taking medications on a regular basis. So there are epidural injections, which can help with chronic nerve pain, especially from spinal cord issues. There are also trigger point injections if people have muscle tension and spasticity in certain areas. A small needle can be inserted into that area and a steroid or anti-inflammatory can be delivered. Also, radiofrequency ablation is a procedure where, for lack of a better term, they kind of burn the nerve endings if the pain is really severe and other procedures aren't working. And that can sometimes provide pain relief. Implantable devices can sometimes be used. They're not used as much as they used to be in the past, but for instance, there are pumps that can be implanted with medicine, pain medicine, or either spasticity medicine that can help decrease symptoms. And then in some cases, especially for symptoms like, for instance, trigeminal neuralgia, there are some surgeries that may help relieve some of the symptoms of pain. Now, let's talk about more kind of complementary things outside of medication and traditional procedures like surgical procedures. So physiatry and physical therapy are extremely important to management of pain. And there are some conditions, especially like low back pain, where oftentimes I can't even order a MRI or a study until I've sent someone to physical therapy for management, right? So it can manage many chronic pain conditions as well as spasticity. For some people, physical therapy can help with things like frozen shoulders or low back pain or chronic neck pain, because there are many different techniques that can be applied in physical therapy to help with that. Other major reasons I often send people to physical therapy is to develop individualized exercise training programs, because the goal is always for you to continue to do the activity at home. It often is a case where we can't do physical therapy forever. So we want people to have the tools that they need to be able to continue their activity at home and to keep up their functioning. And then also they can help us with appropriate walking assistive devices, whether it's a cane or a walker, et cetera. And sometimes the pain that people have is because they may be compensating for a weak side, or they may be using their walking device inappropriately. And so it's always good to have that assessment by a professional, specifically a MS trained physical therapist, if there's one available, that can help you to manage those symptoms. What about exercise? So there's no limit to the benefits of exercise, but these are just a few, right? So exercise is extremely important. Whether you're in physical therapy, I often recommend that first to get your individualized plan rather than you going out there and just making up your own plan. But once you continue that plan, exercise can improve cardiovascular health, can also help strengthen weakened muscles, as well as help you to maintain the strength that you have, boost the mood, and decrease constipation and decrease pain. So all of these are additional benefits for exercise aside from helping to decrease pain, which it can also do. And what about yoga? I'm a huge advocate of yoga for my patients. Mindy knows that. So I'm a huge advocate for a variety of reasons.
Namaste.
Namaste, right? So for a variety of reasons, but some of which include decreasing symptoms like spasticity, right? So yoga can be very helpful to decrease spasticity and also can help decrease chronic pain, because when you're doing yoga, you have to bring attention to areas of your body where you may be holding tension. I remember when I first started doing yoga about 20 years ago, I didn't realize that I was walking around with my shoulders in my ears like this all the time. And every time I went to class, the teacher would say, put your shoulders down, and I would do it. And then like 2 seconds later, they would be up again. And I'm being a little dramatic, but we don't realize that there's certain areas of our bodies where we may hold tension and that may exacerbate or worsen pain. And so being able to kind of focus on those and relax those muscles can help a lot with decreasing pain as well as decreasing spasticity. The other thing that I love about yoga is that it can be adapted for various levels of ability. And so I always say there is a position that's for everyone, right? So if yours is to stand with your feet together in tree, that's great. If you can twist your leg all the way up, then that's great as well. But there's a level for everyone. And so it can certainly be adapted to different levels of ability. Massage therapy, also one of my favorites, right? So massage therapy can often help because, again, oftentimes when people are dealing with pain and spasticity, they can have certain points in the body that where you can actually develop knots in the muscles. And so massage therapy can help to decrease pain in those areas, those trigger areas, can also help with decreasing spasticity, boosting mood, and promoting relaxation. And good massage therapists also often do stretching. And so when they do stretching, that also helps to relieve some of the tension in the muscles and draw attention to areas where you may be holding tension or where you may need to go back to your physical therapist and kind of work on decreasing those areas of tension and pain as well. What about acupuncture? So, acupuncture is a traditional form of Chinese medicine. It's been around forever. But more recently has been used in the Western world and also has become increasingly noticed in the field of MS. And so it can be used to help a variety of symptoms. So basically these small needles are inserted into areas of the body, and the premise behind the traditional Chinese medicine is that there is a qi or flow of energy throughout the body. And so basically when that energy is blocked, it can result in pain. So the insertion of the needles in the certain types of body are to try to unblock that energy and to allow it to flow in different ways to decrease symptoms of pain. There are also some Western beliefs about, maybe inserting the needle in the muscles may release certain chemicals in the body to decrease pain, but there's certainly a lot that we don't understand and know. There have been some small studies that suggest that scalp acupuncture may actually work a little bit better in MS, but certainly we don't have a lot of research. So there's a lot of work that needs to be done for us to better understand acupuncture and how it may help relieve pain for people with MS. But we know that it has been used to help decrease pain and spasticity, as well as numbness, as well as to help decrease depression and improve mood. And what about functional electric stimulation? So this is a newer modality of pain relief that's been used. Traditionally, the most common device that we see with FES and MS are things like the BioNess device, right? Or the walk aid. And these are basically devices that cause an electrical impulse to stimulate the muscle to move. So the BioNess and the walk aid are used for foot drop. So it will stimulate the muscle so that the foot will contract or lift up so that people can walk better. But it can also be used to block certain pain signals in the body. And this is an example of a device that can be used and potentially restore and improve certain bodily functions, such as bowel and bladder control. So again, something that is it's been used for some time, but relatively newer in terms of looking at the effects and improvement with multiple sclerosis. And there actually have been a couple of studies that have looked at simultaneous functional electrical stimulation as well as brainwave monitoring. And there are some hints that that may help with neuroplasticity or repair of the nerves. But certainly, again, one of those areas where there's a lot of research that needs to be done for us to better understand this. Biofeedback. So this is another area where basically different monitors are used to measure different bodily functions. So heart rate, breathing rate, commonly blood pressure, skin temperature, and brain waves are monitored with different devices. And so essentially what happens is that oftentimes when we are tense or have anxiety or have pain, essentially you're looking at these responses and they may be on a screen or be a flash or a sound to signify these different things. And you can practice relaxation techniques so you can see what actually works to help decrease that response in yourself. And so these can be done by a psychiatrist, a psychologist, other physicians can do biofeedback sessions. They last roughly a little bit to an hour and a half, and have been shown to decrease some symptoms of anxiety as well as chronic pain and depression. Mindfulness and meditation, another one of my favorites. So often employs things such as deep breathing, guided imagery, progressive relaxation, again, because oftentimes stress worsens chronic pain symptoms. And so when we're able to relax those muscles, focus on the areas where we hold tension and relax them, it often can improve pain. All right, so with that being said, I'm the Nerdy Neurologist. Here's how you can stay connected to me. I am on many social media platforms. My website is listed there, and I also have a podcast called Brain Chat with the Nerdy Neurologist that is on all podcast platforms that you can subscribe to. We do a Facebook Live generally every other Monday night where we talk about different topics related to MS. Mindy was on my show, and Dr. Gretchen has been on my show. So looking forward to covering some amazing topics in the future. And then this close to my last slide, talking about living well. And I like this quote by Maya Angelou that says, "My mission in life is not merely to survive, but to thrive and to do so with some passion, some compassion, some humor, and some style." And my last quote for every presentation I give, all I need is peace, love, and a freaking cure for multiple sclerosis. Thank you so much. And I think we've got maybe 5 minutes for questions. Thank you very much. All right, so let me look in the chat.
I don't know how you come up with nerdy neurologist, because how can someone nerdy be so cool? You are so awesome.
I am so nerdy. I'm so nerdy. Okay, all right. So let me look at some of these questions here. So I see a couple of comments. I'm going to go backwards about the bias, and one asks, how do you afford the bias? So unfortunately, the last time I checked, most insurance companies do not cover it for MS, but oftentimes there are grants that can be applied for to help pay for the bias. And so that would be something you would talk to your physician about, and also potentially talk to your physical therapist. The other cool thing is that oftentimes in physical therapy, you can try it out, right, to see if it's working. And in some cases, you can rent one to see if it's working, for a long enough period of time to really see if it's helping you, because you certainly don't want to, blow $500 on a device that's not helping you. And let's see.
How about the MS hug? There's a question about, my pain is primarily with the MS hug. How do you address that?
Yeah, so the MS hug is a form of spasticity. So that one is a little bit more difficult to treat. It usually is treated with things like medications, right? Sometimes massage therapy may help, but generally we treat the MS hug with medications, because oftentimes people can also have a sensation where they have difficulty breathing. And that usually comes from a lesion in the middle area of the spine that we call the thoracic spine. And so lesions there can cause that tightness that feels like a girdle, or feels like a corset, some people say, and then it's traditionally called the MS hug, although it is not a pleasant hug, and most hugs are pleasant.
That's so true. We have some students who've really helped it out through side bends.
Yeah,
And
absolutely.
banana pose. They do it
Yeah.
every day religiously.
Absolutely, absolutely. Okay, let's see.
Someone asked a question about electric sensation in the foot.
Okay, let's see. Electric sensation in the foot. Let's see. Okay. So some people can have, again, one of the manifestations of pain can be an electrical sensation, and that can occur in a variety of areas. Sometimes it's in the hand. The picture that I had up was of a sensation in the hand. Sometimes it can be in the feet. You know, the important thing is that if someone has a chronic condition, like let's say diabetes, that can cause neuropathy, sometimes that pain can be from neuropathy, but other times it can be from MS. So it's important to make sure you talk to your doctor to see if you have lesions in areas that would be more likely to cause you to have foot pain. Usually it's something in the spine, or if they think it's due to some other condition. All right, and then I see a question about, is it common to get spasticity in fascia? So that will probably be a little bit better question for Dr. Gretchen, but you can have spasticity. Spasticity from MS is usually in the muscles. Sometimes people can have tightness in the fascia, and those are the bands that basically kind of connect the muscles. So sometimes people can have tightness in the fascia. So for instance, there's a band that runs like from your hip down the side of your leg, your IT band. So sometimes people can have tightness or issues there. But I don't know that we would necessarily call that spasticity specifically. That's usually something we refer to more with the muscles.
What are your thoughts of a CES device?
The CES device. I cannot say that I am familiar with the CES device. Oh, cranial electronic stimulation. Yes. So, you know, so again, when we think about different types of feedback, there are some studies or there's some work that suggests that cranial electronic stimulation may help with some symptoms like depression or help with things like migraines or headaches. You know, I think that there's still a lot of work that needs to be done to better understand how to use these. But certainly migraine, cranial electronic stimulation can help, and then some mood issues, it may help as well. And then, as I said, when we talk about acupuncture, actually scalp acupuncture, which is not an electronic stimulation, but is stimulation of different points on the head, has been one that may have been shown to be more helpful with MS. So that may be related. Okay, and let's see, is it okay to practice power yoga? So yes, I mean, so in terms of exercise, it really is about what you can tolerate. You know, so I don't necessarily, so again, I generally recommend if people have any mobility issues, any symptoms like spasticity or impairment in that regard, that we start with physical therapy, because they can give you kind of directed movements and exercises. If a person does not have any of those impairments, there's not a reason why they can't do honestly any type of exercise they want to. I have patients who are marathon runners who have MS. I have folks who do triathlons. I have folks who climb mountains, do all kind of stuff. You know, so there's not necessarily a reason you can't do it just because you have MS, but certainly if you have issues with spasticity or mobility, it may be helpful to seek a medical opinion through physical therapy first, to make sure that you're doing your exercises safely. All right, and somebody said I make them chuckle. Okay, and then I'll answer just one more. What do you think about, wait, I'm working with two PTs. Okay, someone asked, what do I think about stem cell therapy? Okay, so I'll answer this super, super quickly. So stem cell therapy the research has been going on for decades with MS. So the first thing to say is that stem cell therapy is not new. There's been research going on since the 80s about stem cell therapy with MS. And there are studies that suggest that hematopoietic stem cell transplant, right? We're talking about bone marrow transplant, like what people get for cancer, can help change the course of disease with MS. But the thing that I always caution people about is, number one, make sure you talk to your doctor before you have any procedure. But there are also many different procedures that people are doing that are calling stem cell, which is not the same as hematopoietic or bone marrow transplantation. So some people are doing fat stem cells. There's some clinics where people are paying, enormous amounts of money, $10,000, $15,000 a year to have these procedures. Just make sure that you consult your doctor to make sure that it is something that is safe and that's something that's right for you. So with that being said, thank you all so much. Please get the rest of your questions to Mindy and I'll try to answer them at some point. And I will hand it back over to Dr. Belkin.